All right, section 17.3, procedures and pharmacology, diagnostic and therapeutic procedures for disorders of the pituitary gland. Visual field tests can show the presence of a pituitary tumor as as the tumor presses on the optic chiasma, causing loss of vision in the peripheral visual fields. Levels of pituitary hormones in the blood and or urine can be measured directly to show the presence of a hormone-producing pituitary adenoma or adenoma. Okay, that feels good. Oh, cool. Got some lip gloss. Examples of the levels of growth hormone and insulin-like growth factor IGF-1 when growth hormone levels are high, they cause the liver to produce more IGF-1. When both levels are very high, a pituitary tumor is the diagnosis. If the levels are only slightly increased, a glucose suppression test is performed. Ingestion of large amount of sugar normally leads to a drop in growth hormone levels. If growth hormones remain high, a pituitary adenoma is the cause. High levels of growth hormone are found in gigantism, beginning in children, and acromegaly, beginning in adults. Blood prolactin levels can be measured to check for prolactinoma. ACTH corticotropin levels help distinguish ACTH secreting pituitary tumors from adrenal gland tumors. TSH thyrotropin levels usually identify thyrotropin secreting adenomas. Diabetes insipidus caused by failure in production of ADH antidiuretic hormone by the hypothalamus or by failure of the posterior pituitary to release it due to adenoma is diagnosed primarily by measurement of the amount of urine and its osmolality. Magnetic resonance imaging (MRI) can show pituitary tumors greater than 3 millimeters across. Biopsy of the tumor is sometimes needed to make a firm diagnosis. When pituitary tumors are removed surgically, they are always examined under a microscope to confirm the exact diagnosis. Therapeutic procedures. Surgical removal of a pituitary tumor is necessary if the tumor is pressing on the optic nerves or if it is overproducing hormones. In 99% of cases, this is performed by an endoscopic transnasal transphenoidal approach, in which the surgery is performed through the nose and sphenoid sinus using an endoscope. Craniotomy, in which a very large tumor is removed through the upper part of the skull, is occasionally necessary. The surgery can be made more efficient by using image-guided stereotactic surgery, in which advanced computers create a three-dimensional image of the tumor to guide the surgeon. Radiation therapy can be used alone after surgery or if the tumor persists or returns after surgery. Methods of radiation therapy include gamma knife stereotactic radiosurgery, which delivers a single high-dose radiation beam the size and shape of the tumor using special brain imaging techniques; proton beam therapy, which delivers positive charged ions, protons, rather than X-rays in beams that are finely controlled with minimal risk to surrounding healthy tissues. External beam radiation, which delivers X rays in small increments, usually 5 times a week over a 4 to 6 week period, and may damage surrounding healthy pituitary and brain tissues. Medications and hormone replacement therapy. Medications can help to block excessive hormone secretion and sometimes reduce pituitary tumor size. Growth hormone secreting tumors have 2 types of drugs used if surgery has been unsuccessful in normalizing growth hormone production. Hi there. Somatostatin analogs, Sandostatin, Somatoline Depot, cause a decrease in growth hormone production and are given by injection every 4 weeks. The second type, Pegvisomavir, blocks the effort of excess growth hormone, is given a daily injection and may cause liver damage. Prolactin secreting tumors, prolactinomas, are treated with 2 drugs, cabergoline and bromocriptine, that decrease prolactin secretion, but they can have serious side effects, including developing compulsive disorders. Pituitary hormone replacement therapy is needed after surgery or radiation therapy to maintain normal hormone levels. The medication taken depends on the hormones that need to be replaced, which include adrenocorticotropic hormone ACTH, thyroxine, estrogen and progesterone, testosterone, antidiuretic hormone ADH, and synthetic growth hormones. Treatment of diabetes insipidus is with vasopressin and desmopressin, synthetic modified forms of ADH. They are taken as nasal spray several times daily. The dose being adjusted to maintain a normal urine output. Adenoma, a benign neoplasm of epithelial tissue. Analog, a compound that resembles another in structure but not in function. Analog is a means of the transmission of continuous information to our senses, in contrast with the digital transmission of only zeros and ones. Biopsy, process of removing tissue from living patients from microscopic examination. Chiasm is X-shaped crossing of the 2 optic nerves at the base of the brain. Chiasma is an alternative for chiasm. Craniotomy is incision of the skull. Endoscope, instrument for viewing inside the tubular hollow organ. Endoscopic, pertaining to an endoscope. Gamma knife, a minimally invasive radiosurgical system. 3rd letter in Greek alphabet. Knife, okay. Optic, pertaining to the eye. Osmolality, the concentration of a solution. Protein, positively charged unit of the nuclear mass. Stereotactic, pertaining to a precise 3-dimensional method to locate a lesion or a tumor. Transnasal is through the nose. Transphenoid is through the sphenoid sinus. Tumor is any abnormal swelling. Okay, diagnostic procedures. For diagnostic therapeutic procedures, disorders of the thyroid gland. Thyroid stimulating hormone TSH levels in the blood are low if the gland is overactive. Thyroid hormone levels in the blood detail the activity of the gland. The levels are high if the gland is overactive. Antithyroid antibodies are associated with autoimmune inflammatory diseases of the thyroid. Isotopic thyroid scans detail the nature of the thyroid enlargement and the function of the gland. Serum calcium level is elevated in medullary carcinoma. Fine needle aspiration biopsy distinguishes benign from malignant nodules. Ultrasonography reveals the size of the gland in the presence of the nodules. Therapeutic procedures. Radioactive iodine, I-131 therapy uses the isotope of iodine that emits radiation to treat hypothyroidism and thyroid cancer. When a small dose of the isotope is swallowed, it is absorbed into the bloodstream, taken up from the blood, and concentrated by the cells of the thyroid gland, where it begins destroying the gland cells. Hypothyroidism in most cases can be treated adequately with a constant daily dose of levothyroxine, LT4. For hypothyroidism due to destruction of thyroid cells, TSH levels are monitored. For central pituitary and hypothalamic hypothyroidism, T4 levels are used for monitoring. Thyroid surgery is indicated for a variety of conditions, including cancers and benign nodules, goiters, and overactive thyroid glands. The types of surgery that can be performed include excisional biopsy, removal of a small part of the gland, hemilobectomy, removal of half of the thyroid gland. Total thyroidectomy is removal of all thyroid tissue. Near total thyroidectomy, removal of all but very small part of the gland. Endoscopic thyroidectomy is performed through a single small incision using a flexible lighted tube and video monitor to guide the surgical procedure. Laser ablation, a minimally invasive procedure used to remove benign thyroid nodules using ultrasound guidance without affecting the surrounding organ. That kind of sounds like what we were asking about. Laser ablation for Pulloy surgery. Antithyroid. Okay, thyroid pharmacology. Antithyroid medications prevent. It's really rubbing me down. Antithyroid medications prevent formation of thyroid hormones in the gland cells. Propylthiouracil. How you say? Anyways, and methimazole both decrease the amount of thyroid hormone produced in the gland cells. It can be used to treat hyperthyroidism. Ultimately, they both have the major and frequent side effects of agranulocytosis and aplastic anemia and are no longer recognized as frontline medication. Okay. Thyroid replacements are L-thyroxine. The synthetic T4 is a preferred replacement. Liothyronine sodium. The synthetic T3 has rapid turnover and must be monitored frequently. So ablate is take away. Removal of tissue to destroy its function. Aspirate is to breathe in. Removal by section of fluid or gas from a body cavity. Isotope, iso meaning equal, tope meaning part. Radioactive elements. Some of these elements are used in diagnostic procedures of identical chemical composition. Isotopic. Do you want to? Lobectomy is surgical removal of a lobe of the lungs or of the thyroid gland. Lymphodectomy is surgical excision of a lymph node. Radioactive iodine, any of the various tracers that emit alpha, beta, or gamma rays. Ultrasonography is delineation of deep structures using sound waves. Therapeutic procedures for parathyroid and thymus glands. Parathyroid gland disorders are diagnosed by blood test calcium and vitamin D levels. Hyperparathyroidism, watchful waiting, surgery to remove enlarged parathyroid gland. Surgical removal of the enlarged gland is curative. Calcimimetics, such as Stinacalcet, Sensipar, trick the parathyroid gland into thinking there is more calcium in the blood than there actually is, decreasing secretion of PTH. Vitamin D supplements if blood levels of vitamin D are low. Hypoparathyroidism, high dose calcium and vitamin D supplements, a genetically engineered recombinant form of PTH. Thymus DeGeorge